Good evening. Today's Wednesday. We just got off the Senate floor not too long ago, and today we passed the Health and Human Services Omnibus budget bill. So this is a fantastic bill. I'm really proud of it. This is the first of our budget bills that we have passed where I sit on and serve on the committee, and so I've got a number of bills in this package bill. So it's a big bill. There's a lot of great things. I could talk for half an hour or more on the bill, but I won't do that. But I do want to take a little bit of time to just walk through a few things that are in the bill that I'm most proud of and excited about, and share some of my bills that got included. So broadly speaking, this bill makes bold investments. It includes $1.5 billion in fiscal year 24 and 25 and $1.8 billion in fiscal year 26 and 27. So big and bold investments that are needed and necessary. There are sort of two sections of this bill. One is around children and families. There was two budget targets that were combined into this bill. So children and families is one, and then the other is just related to healthcare. And so I'm going to talk about the children and families first. I've got my notes here so I don't forget anything. So really, through this bill, we are demonstrating a historic commitment to making Minnesota the best state for families and children. This budget will make transformational investments in our youngest Minnesotans to be sure that they can achieve their highest potential. It reimagines systems and prioritizes children and families. It really will help Minnesotans across the state with supports that will provide stability and economic well-being. So some provisions that are included. One is increasing access to childcare. We increase the rates for the Child Care Assistance Program up to the 75th percentile, which is the federal standard. We have been below that for quite some time. And what that means is being up to that 75th percentile, it expands access. It means that more families will have access and more options for where to send their littles for childcare, which is a great thing. There's provisions to strengthen our childcare workforce. It includes retention grants. We know that the workforce behind the workforce, the folks doing this critically important work to care for and educate our little ones, oftentimes don't make a living wage. And so this helps with that. It makes investments so that they do and they can, and we can retain them in that critically important work. It creates a Department of Children, Youth, and Families. So this is really exciting. This is a way to reimagine services for families. That new agency will coordinate and prioritize state services and programs for supporting whole families. This bill addresses homelessness statewide, and this is one of my bills that is in this package is a bill for Olmsted County grants to prevent homelessness, and so really proud of that. It also provides increased support for Minnesotans in need, so support to keep up with inflationary costs for Minnesotans who qualify for cash assistance and other benefits. And the last thing I'll mention is just that it breaks down some barriers. It eliminates some administrative burdens and really aligns policies to reduce barriers to benefits for Minnesotans. So lots of ways in this bill that we are helping children and families, exactly the work that we should be doing. So really proud of that. The other part of this bill is the healthcare pieces. Also really, really important to me. And so some of those include expanding healthcare access. This bill creates a public option, allows the public to buy into Minnesota Care, which really just allows more people access to care. This includes our undocumented neighbors up to age 19. I think that doesn't go far enough. I really am working to be sure that we're not leaving anyone behind, and including all of our undocumented neighbors. We know that we all do better when we all have access to care. It also, and this is one of my bills, reinstates the full adult dental benefit set for medical assistance for the first time since 2009. So really, really important. Everyone should have access to dental care. Again, we know it is far more, it's just the right thing to do. Also, it's far more cost effective to cover folks' dental care. If we don't do that, we actually pay more in the long run through emergency room visits and hospital stays. So important to do that. It creates a healthcare affordability board, which will limit cost increases and promote transparency in healthcare. We know, healthcare is outrageously expensive, and so this is one way to address that. It strengthens our mental health care system. It this is another one of my bills I'm really proud of. It has a significant rate increase for providers for mental health services. It also includes funding for the 988 Suicide and Crisis Lifeline. So that's the number that's similar to 911, but 988, which is specific to mental health issues. This bill also prioritizes health equity. So it includes funding for Minnesota Department of Health Office of African American Health and an Office of American Indian Health, and creates an equitable healthcare task force. So all really important pieces. We know we have significant racial disparities in our healthcare system here in Minnesota. So that is one way to address that. Another thing I'm very excited about and supportive of is the Keeping the Nurses at the Bedside Act. And so this is one way to address our workforce crisis. We know that we have a shortage of healthcare staff and healthcare workers. And so this provision around bedside nurses at the hospital, of which of course I am one of the reasons I support this, it includes loan forgiveness for nurses. It includes programs around workplace safety, and a way for nurses to have a voice at the table around staffing, which is critically important. We also, in this bill, make investments in public health and climate resilience, really, really important as we move towards the future. It invests in emergency preparedness, responsible sustainability, the strategic healthcare stockpile, and local public health and drinking water, all really, really important things. Lastly, I just want to make note of a couple of other of my bills that are in this package bill that we passed. I have spoken about this before, but my bill around requirements for hospitals to provide information to patients about charity care and insurance programs they may qualify for before they put them into collections or start litigation to collect their medical debt. So we know medical debt is a huge issue. Just asking for those hospitals to provide information to patients that they might qualify for help before they go into collections for that debt. My provision around grants for labor trafficking was included. Really excited about that. I have a bill around critical access dental facilities. Again, that dental care, especially in rural parts of the state, is a challenge. And so providing some funding for those critical access sites. Workplace safety grants, I've spoken about this before, but everyone should be safe at work. And so we know that's an issue with our healthcare staff. And so providing some grants to facilities to be able to take steps to keep staff safer. My bill for the diaper distribution grant program is included, so very excited about that. And the last thing I'll mention is related to childcare workers. As I talked about, I have a bill that I have spoken about before that creates an apprenticeship program for early childcare workers to get, to recruit more people into that space. So that's a big bill. There's a lot more included. If you have questions about what is or is not in the bill, I'm happy to chat about that. We passed our bill, as I said, off the Senate floor today. It will match up with the House version in a conference committee, and we'll see what gets across the finish line. But lots of really great pieces really will have an impact on the lives of Minnesotans. So I'm honored to be able to do this work and was a enthusiastic yes vote for that today. So I'm going to sign off. We have the State of the State address tonight, so getting ready for that. And I will be back in touch later this week to talk about the other bills that we passed later in the week. So thank you. Have a good night.